Inventory is a crucial aspect of any business's logistical decisions. Inventory, put simply, is the stocks of goods and materials that are maintained by a company in order to service customer needs. It is an important component of logistics as it affects the bottom line. If the wrong decisions are made regarding inventory, the company could lose money. There are various classifications within the umbrella concept of inventory, and one of these is substitute products. Substitute products are products that can fill the same need or want as another product. An example of this is tomato sauce. One brand of tomato sauce can be seen as a substitute for a different brand of tomato sauce. Or, in a slightly less direct comparison, rice milk can be seen as a substitute for cow's milk. This differs from tomato sauce in that the sauce from each brand would essentially be the same, but the milk products, however, are vastly different, even though they can be used in the same ways. When it comes to substitute products, different types of companies have different decisions to make regarding this inventory, as substitute products do have different implications in different situations. One example of this is a supermarket and a hospital. While both supermarkets and hospitals are similar in the fact that they provide a service, the nature of that service is a vastly different thing. A supermarket is providing their service to customers who are seeking to purchase their products, whereas a hospital is providing their service to patients who are seeking to be treated for injury or illness. In this way, each party's attitude towards substitute products is very different. It is known that customers of supermarkets have a high willingness to purchase substitute products. For most supermarket customers, having to purchase, say, a different brand of tomato sauce is nothing of severe concern. If a supermarket runs out of stock of one brand, customers will, more likely than not, be happy to purchase another brand in the meantime. This willingness allows supermarkets some flexibility when it comes to their inventory decisions. Stockout is something that can be effectively navigated so long as there are sufficient substitute products available for purchase by customers. For perishable products, such as bread, it has been found that 84% of customers would buy a substitute product, i.e. another brand of bread, in their usual store, rather than purchase their usual brand at a different store. However, that percentage is lower for non-perishable items, at around 50%. Although non-perishable items are often purchased less often by customers than perishable items such as bread, milk, meat, etc., meaning that customers are less inclined to need them immediately and may get them another time at another place rather than buy a substitute. Additionally, it is worth noting that stockouts and limited product variety are suggested to be the biggest cause of dissatisfaction among supermarket customers. This alone means that, in deciding what inventory to carry, a supermarket should consider having many substitute products available so as to avoid such dissatisfaction. Supermarkets also function in a highly competitive market, which influences their stock decisions. This means that stocking a variety of alternatives is an integral part of the service supermarkets provide to customers. Customers enter a supermarket, browse the aisles, and then they select the options that best suit them. This prevalence of options given at any one time naturally leaves supermarket customers likely to select substitute products rather than a different store. However, this does not mean that stockouts should be ignored or treated without seriousness. A competitive market means that customers have options for where to shop as well, and they will go somewhere else if need be. Having a reputation for reliable product availability is a strong asset for a supermarket, meaning that their main aim with inventory is to ensure that they have the right types and amounts of inventory available to meet customers' needs at all times. A hospital's main aim, however, will be different, as there are many other considerations to make. Hospitals have issues with using substitute products that supermarkets would not have. While the supermarket is focused on providing for consumer demands, a hospital's main purpose is the caretaking of sick and injured people. Substitute products to be used by hospitals must therefore be carefully considered in this light. Substitute products in hospitals are used to treat patients, for example, component parts for an IV. Due to this fact, safety is the biggest part of deciding on a substitute product. Those involved must consider how safe the substitute is, if any educational needs will arise from the introduction of this product, if there could be any complications with patients due to using this substitute, and, if the substitute product is a part for a piece of equipment, the compatibility and subsequent safety of using the part. Additionally, some products in the hospital system are incredibly specialised, and replacements are hard to find if they are available at all. A lack of possible substitutes can affect the use of certain equipment in the system, which is a troubling issue. If required parts are on back order and a hospital cannot acquire them, they may not be able to run the necessary equipment. Therefore, sufficient communication channels need to be established between suppliers and hospitals so that hospitals know as soon as possible that they will need to search for a suitable substitute product. As hospitals are in charge of providing care for vulnerable people, the issue of substitute products extends deeper and holds more complications than that of supermarkets. While supermarkets must make decisions around substitute products so as to best cater to customers' needs and to maintain favour over their competitors, hospitals must manage substitute products with staff and patient safety in mind first and foremost. The nature of the inventory supermarkets and hospitals require is the biggest defining factor between the two. Customers at a supermarket can select a different product or attend a different store. Patients at a hospital are reliant on their hospital making the correct choices to maintain their safety and level of care. While substitute products are important for both parties, the drivers behind their decisions are very different.